I initially thought that I did not want to do pediatrics, but then when I had my pediatrics rotation, I quickly realized how much I loved it. Kids are resilient. They are just a totally different population to work with, and I really love that part of coming to work every day. My name is Julie Bass. I'm the Pediatric Inflammatory Bowel Disease Program Director. We treat patients with inflammatory bowel disease, which is Crohn's disease or ulcerative colitis. My approach to patient care is very patient and family centered. I really want to know what is the most important piece of getting a child feeling better when we make decisions about the best treatment for their disease. There are a lot of medications that are really, really changing how we can treat this disease and truly healing the intestines. Before, we were somewhat limited, using a lot of steroids that can cause difficult side effects, and more kids were having to go to surgery right away, but thankfully we have a lot more options to try before we may need to consider surgery as one of the treatment options for this disease. I'm very excited that we are finally starting to enroll patients in the Crohn's and colitis funded study of 12 different pediatric centers across the country that will be following pediatric inflammatory bowel disease patients over time and learning from that data to help determine which patients will ultimately respond to which types of treatments. I do think that Children's Mercy has a lot to offer in terms of hope and making sure you're getting the absolute best standard of care for inflammatory bowel disease. We have a team dedicated to taking care of these kids. We have an active parent-family advisory council, and then we just keep open lines of communication to make sure that we are doing everything that we can along the way to make sure that we are making the best decisions for our patient to ultimately make it the best experience for them.